Hi guys and welcome back to Jawtoon Life channel. Don't be so surprised. You're not in the wrong channel. You are in the right place. And because most of the video in this channel is Jawtoon Life, of course, because the name of channel is Jawtoon Life. But I don't want it to be like only Toon channel, but I want it to be our channel. So this time I try to do something like I think it is informative and useful for you guys, and that is why I want to share my experience about my skin cancer.
Audio Jungle. Audio Jungle.
If you have seen the recent video, you would know that I am a gym rat. But I also really like outdoor sport like surfing, tennis, cliff climbing. And it all began with this. Whenever I go outside, my mom always told me, "Hey, put on your sunscreen." And I was like, no, it was so sticky and annoying, and I'm not a person who gets tan so easy, you know, right? So just ignored her and ignored everything. One day I woke up and see more on my cheek, but I think it is just normal, so I just ignored it. But the mole is not just a mole. It keeps growing bigger and bigger and look weird. I went to doctor immediately and she looked carefully at my I would call it a mole, and she said it might be melanoma, which is the most dangerous type of skin cancer. And I was shocked, but it is not a sad or depressed feeling. It's just, Then she examined me from head to toe and said that I have to do a blood testing, an MRI scan, and PET scan, which show where the body uses glucose for energy, because cancer cells consume more glucose than others. And for sure, ignorance like me don't have information about that. So I decided to research everything about skin cancer, and I think it is useful and it would be nice if I share this with you guys. So let's get started. What is a skin cancer? Skin cancer is an uncontrolled growth of abnormal skin cell, which caused by change in DNA, and it mostly caused by overexposure to ultraviolet. There are two sites that skin cancer originates: keratinocyte and melanocyte. About 97% of patients have skin cancer that originated from keratinocyte, but 80% of deaths are from skin cancer in melanocyte. Keratinocyte is curable, and there are two minor types of keratinocyte, which are basal cell carcinoma or BCC and squamous cell carcinoma or SCC. The skin cancer that originated in melanocyte is called melanoma. Skin cancer can develop at anywhere on your body, but most of them develop on an overexposure skin region. There are many risk factors that cause skin cancer. If your family has a history about it, you have risk of skin cancer. People with light skin and eyes also have more risk. Getting too much UV ray also a risk, including sunburn and tanning bed usage. Moreover, men also have more risk than women to have a skin cancer. To prevent this, we can avoid sun exposure, put on your sunscreen, wear sunglasses and hat whenever you go outside, and avoid tanning bed because it is really damage your skin when you put on tanning. And always check and take care of your skin regularly so you don't get skin cancer. One more thing, if you already got a skin cancer, the complication of skin cancer are risk of recurrence. And it also increases the risk of other type of skin cancer too. So that is why once you get your first skin cancer, it can be very, very, very dangerous after that. The first type of non-melanoma skin cancer is BCC. BCC begins in basal cell. It is the most common type of skin cancer, and its tumor often look like the sores, bumps, scar, or red patches, but it is painless. There are 5 types of BCC, which are pigmented BCC, which appear as a black or brown lesion. Superficial BCC, a reddish patch on skin. Non-ulcerative BCC, which is a white bump on the skin. Morphiform BCC, which is a scar-like lesion. And basal squamous BCC, which carry both BCC and SCC traits. This type is extremely rare and more likely to spread out. The next type of non-melanoma cell is SCC, or a squamous carcinoma cell, which begin in squamous cell. You can notice it by looking at your skin. If your skin have a scaly red patches or wart-like, it is SCC. And there are 5 stages of cancer cell that originated from keratinocyte. Stage 0 is when the cancer cell is only present in epidermis. Stage 1 is when the tumor size is less than 2 cm. And stage 2 is tumor size is larger than 2 cm. And stage 3, the cancer spread to nearby tissue or bone and the size is larger than 3 cm. Stage 4, which is the last stage, is when the cancer spread to the lymph node and they are larger than 3 cm in size. To diagnose keratinocyte skin cancer, first, the dermatologist will have the visual inspection from head to toe and ask about your skin cancer history. If there are any suspect, they will remove the small portion of affected skin to a biopsy. The treatment of skin cancer are based on the condition of cancer, age, health, and the location. There are many types of treatment to cure keratinocytes, such as mole micrographic surgery, which is a removal of abnormal skin and examine it. The process will repeat until there are no cancer cells left. Excisional surgery, which is the removal of the abnormal cell and normal cell. Cryosurgery, which is not cutting the cancer cell like before, but it is a usage of liquid nitrogen to freeze and kill the cancer cell. Another thing is radiation, by using high energy of X-ray to kill the cancer. And the last one is laser. Melanoma is a rare abnormal skin cancer. It can develop anywhere, even in the eyes. To diagnose the melanoma, the doctor will first have physical exam from head to toe, just like keratinocyte. But if there are any suspect of the affected area, the doctor will decide to use CT scan, MRI scan, PET scan, blood testing, or biopsy to examine the suspected area. Melanoma has TNM staging name, which stands for tumor, lymph node, and metastasize. Melanoma is a life-threatening skin cancer. It has more detailed stage than keratinocytes. At stage 0, the cancer is only present in epidermis, just like keratinocyte. The next stage is stage 1, but it's not only 1, but it's a stage 1A. The tumor is less than 1 millimeter thick. And next there's stage 1B. There are less than 1 millimeter crack on skin, but the doctor will remove abnormal and some normal cell and have some follow-up in this initial 3 stage. Stage 2A, the tumor is 1 to 2 millimeter thick and has 2 to 4 millimeter crack. Stage 2B, the tumor is 2 to 4 millimeter thick and has more than 4 millimeter crack appearance. Stage 2C, the tumor and crack is more than 4 millimeter thick, and in the next 3 stages, the doctor will remove the abnormal and some normal cell just like first 3 stages, but the additional treatment such as chemotherapy and radiation is recommended or needed. Stage 3A, 3B, and 3C. In this stage, the cancerous cell have spread to the lymph nodes or some tissues. And the last stage is the stage 4. The cancerous cell have spread far beyond the original tumor. In the last 4 stage, the doctor will have surgical removal of lymph nodes and provide additional treatment such as immunotherapy. And that is all from me. Remember to protect yourself as much as you can do. Just don't be another statistic like me.